Hey, it's Dr. Hillary. I decided to do a little live Q&A today. So, like we did last time, we've got a little spinny wheel, and I've got a bowl full of questions that you guys have already asked me. And I'm going to read a few out and give you some answers, and then whoever's question is going to win from the spinny wheel. Not only do I love giving out gifts, but I also love just spinning the wheel. That's like my gift to myself today. So let's see who's first up. We've got quite a few, so we're not going to get through all of them today. Kristen East asks, what's the most common myth about chiropractic care? I feel like there might be two. I'm trying to decide which I've heard the most. A lot of people go, well, I heard it hurts. And so any of you that are patients of mine, you know that it doesn't hurt. It doesn't have to hurt. There are probably some chiropractors that are a little forceful and it hurts. But if you're already in a lot of pain, I guess it could sometimes hurt. But there are a lot of different techniques and tools. There's actually 200 techniques for adjusting the spine. And it's like finding one that you like and you feel comfortable with. So we do a variety at our office, from a little activator tool. It makes like a little clicking noise, to like hands-on manual, or where the table like drops up and falls down. So like I said, there's like 200 ways. It's hard to tell you if it's going to hurt or not. But most people are pleasantly surprised and get off the table and are like, oh, that was it? I thought you were going to run and jump on me. And I'm like, well, it's not WWE style or whatever the wrestling show is. It's gentle and effective. Another common myth I hear about chiropractic care is, well, I used to, I don't hear it anymore, but I used to hear people say, well, chiropractors just want you to keep coming back over and over again. And yeah, it's kind of true, because I think of it like, what doctor has ever told you, like, never come back again? Like, oh, you're not blind, so just come back when you're blind, or your teeth look fine, so just come back when they fall out. I mean, no doctor really tells you never to come back. I feel like chiropractors, we tell you to come back more often because we are looking at more preventative things. And if you can get adjusted regularly, it actually prevents a lot and slows down the progression of like deterioration and arthritis. So I guess that is a myth. Like, do you need to come back forever? Yes, but you should want to come back forever, because you are going to continue to use your body over and over again, and that necessitates like the need for care over and over again. Or like my favorite analogy is, it would be great if we could work out like once a month and have great abs, right? Like, I would totally sign up for that workout. Once a month, done. But we all know that it doesn't work that way. And so our bodies just need that repetitiveness because we use it all day long. So, Kristen, great questions. Let's do a little spinny wheel here and see what you win. Ooh, Kristen wins a yoga session. So I will get this to you. It's from Baptiste Power Yoga, and it's here in Carmel, I believe. I just saw it the other day. Oh, on Main Street, yes. So that'll be fun. I feel like we all need a little stretchy. So let's see our next one. And if anyone's watching, feel free to leave some comments. Supposedly, I can see it on the side screen in this StreamYard app. If not, just leave comments in our wellness group afterwards. And this will be recorded, and you can always watch it later. Bree asks, do we take insurance? Good question, Bree. Yes, we do. There's only a few that we don't take. So it's probably easiest just to mention the couple off the top of the head that people ask me about that we don't take. So we don't take Medicaid, and we don't take Indiana HIP plan. So other than that, insurance covers quite a bit, you guys. I just had a patient in the other day for a consult, and she didn't even think her insurance covered it. And she goes, well, why wouldn't my insurance tell me that? And I go, because they don't want to pay. Like, that's how they make their money, is they deny things, right? And then they don't pay, but you keep paying your large monthly premiums all the time. So of course, insurance isn't going to say, like, you know what, you've got 20 visits to use up, you should go. No, they're not going to say that because they don't want to pay. So Bree, good question. Yes, we take insurance. Almost every insurance covers chiropractic care. We can always like look up your insurance benefits too. So a lot of people have been sending pictures of their insurance card, like front and back, to our email. It's office@rangelinechiropractic.com. And then we can just look up the benefits on our portal. So, Bree, this spins for you, girl. Bree, you win Healthy Happy's gift certificates. I think you guys might have seen me post about Healthy Happies. There's one in Carmel and in Westfield. So I went and bought a $5 gift card. Support locally, you guys. They opened up during pandemic. It's wonderful. They have a lot of like protein shakes and energy drinks, and it's like little to no sugar. So that's always a plus for us, trying to like keep our calories and sugar content down. So Healthy Happies. I will get that to you, Bree. Let's see. Who's our next person? Kathy Bitar. She says, can Chiro Care help lower blood pressure? That's so funny because you just put that and posted that. So I was going to look this up and I didn't have time. But yes, Kathy, there is actually research studies. I just need to find them for you. Probably like PubMed online has them to show how consistent chiropractic care lowers blood pressure. And of course, insurance would never allow me to submit for that. They only think chiropractic can help with neck and back pain. But yes, because it controls the nervous system, chiropractic care can lower blood pressure. And what would be great is to do like before and afters. Like you take the blood pressure, like on the new patient exam that we do, and then after care. So yes, to an extent. Is it like an instant? No. But I have had other patients not have to get on blood pressure medication. I don't personally take them off of their medication, but if they're telling me like, hey, my doctor wants me to get on blood pressure medication, what do you think? Then I would say, hey, why don't we try some consistent chiropractic care for a while? And then after a certain number of time, look at what the blood pressure is. So good question, Kathy. That's not normally something people ask me. So you really made me dig in, and I can definitely find the research on that. Just off the top of my head, I don't have it. So Kathy, let's see what you're going to win. Ooh, nice job, Kathy. So this is Uplift Intimate Apparel. So Uplift is in Carmel in City Center, and Carla is the owner. She's wonderful. Again, you guys know how much I love to support local, especially female-owned businesses. Hey, Carla, if you're watching. So this place, they have things for men and women, but what I love is that she does a great job with profiting. So that's obviously relating a lot to like neck and back issues for patients I see. So Kathy, I will get this to you. I can't see who says miss ya because it just says a Facebook user misses me. But whoever just posted that, thank you. I'm sure I miss you too. All right, let's do another one. Mandy Hensley, what's a good stretch for low back? Ooh, I was just telling a patient this right before I came in here. So Mandy, I don't have room to do it, but do you know the child's pose where like your knees go a little wide and then you like bend forward? That's great because it's not going to aggravate the discs in the low back, but it's going to pull like the lower lumbar spine, and it's going to stretch like the glutes and stuff. So I've been doing a little bit more yoga lately, and so I love the child's pose. I also like, instead of always going forward with the child's pose, I kind of like pull a little bit to the side and do like a side stretch to it. So that's great for low back. Also think about your hip flexors affecting low back pain and your glutes. So hip flexors in the front, it literally takes your leg and flexes it up. And so there's like different lunge type things for that. And then the glutes, like you've probably heard of pigeon pose in yoga. You kind of like fold over half of a leg. And that is a great, like that one kills me. And whenever she's like, we're holding it for 10 breaths, I'm like, we'll see, lady. We'll see. I might just like tap out and go into my child's pose on my own. But good stretches for back. What I don't like for back, Mandy, it might be easier because you know, like how you extend backwards and there's like things that you can go over backwards. I don't love that for a back stretch because I really feel it like compresses the vertebrae and the discs that are like between the vertebrae. It like jams them in there. And then people end up with like disc issues. And if you've ever heard of that, it's no bueno. Oh, hey, Nick, it was you. Yes, you do need to come for a visit. Just because you live out of state doesn't mean you're exempt for coming in for a tune-up. Jeez. Okay, moving on. I got time for a couple more questions. Chris Saylor wants to know about having low back pain and tailbone pain. What causes the tailbone to hurt so much? So the tailbone is also called the sacrum. The sacrum looks kind of like this, and there's actually a little piece on the bottom. It's called the coccyx. If you've ever fallen on it or fallen on your butt, like down the stairs or on ice or playing any sports your life, I mean, sign me up for all those falls. That can cause like some instability in the sacrum or tailbone. And then you know how we sit all day, or at least most of us do. That is putting extra pressure on it. So with chiropractic care, we line up the pelvis, which is like two sides, and then in the middle of it is where the sacrum or tailbone is. And so we look at all that for lining it up. The hard thing is because we do sit all day, it's hard to keep it there. So we do a lot of like strengthening things, or there's certain pillows that people sit on. In fact, I'm sitting on one now. It has like a little V cut out in the back. And so that goes towards the back of the chair, and it kind of props you up so you're not sitting directly on your sacrum or tailbone. And we do have those for sale in the office. I have one at home and one at my office. So Chris, thank you for that. Oh, you know what? I forgot to do your wheel. How can I forget my favorite part? Slacking at my job. Oh, Mandy, you got a 0 space. Mandy's going to get a massage chair coupon. Awesome. You'll love that, Mandy. I think it'll be good for low back if you were thinking about you when you wrote that. Chris, now you get to do the little spinny wheel. Just so you guys know, this is as fun as it looks. Chris, you also get a massage. Yay! Perfect. I feel like I can do one more. Let's see what we got here. Janet. Oh, you just posted this one too. Janet asks, what do I do, as in what do I do as a doctor, to do like the manual manipulations for hiatal hernias for reflux, and how does it help? So she's talking about, I do these like fascial manipulations on the stomach. And so the hiatal area is where the stomach meets the esophagus. And then there is, I think it's called a sphincter. It's like a circular, and it squeezes, but sometimes the stomach goes up through that. And that's called a hiatal hernia, because that's the hiatal region, and a hernia is a protrusion in there. So when the stomach protrudes up through the hiatal area into the esophagus, then people get a lot of like reflux and indigestion. So she says, well, how does my maneuver help? So what I do is I gently manipulate the organs and reduce like the tension in the fascia. So that way we can gently pull the stomach out of the hiatal area and give them more space. It's pretty painless, to be honest. It is weird though, because no one ever massages your stomach, really. I mean, I don't know. That is a totally different, separate thing that I do than like the chiropractic care on the back. So I have had people refer to me from a local functional wellness place that I love. Everyone knows where I love. And they have sent me some patients just to work on the stomach. So I actually don't adjust their spine, because maybe they already go to another chiropractor, but that chiropractor doesn't work on the stomach and the organs. And so I can do that. We call that like a manual therapy. And for instance, like a cost on that, I think is like $35. It's not much, but it is like a treatment that I do. It works great for kids and babies and adults. If anyone's ever had that done by me, you guys always ask over and over for me to do it again because you love it. And again, I can't tell you to get off of your acid reflux medications, but I have heard from others that have willingly given up theirs that it has definitely helped. So it would be great if we could all get off these acid reflux medications and allow our bodies to kind of like heal itself. So Janet, good question. Hiatal hernias and my manipulation. So yeah, just ask me about it. If you guys want to call, and I can always do like a phone call consultation if you're thinking like, hey, she's talking about something that I have, or I know of someone. I do free phone consultations we've been doing on the phone due to COVID lately. So I'm happy to chat for a few minutes. So I'll just throw that out there. And Janet, let's spin your wheel. Janet, you win a lot of stuff here. I'm happy for you. Boom, big money winner. Janet, $20, lady. It's yours. Well, thank you everyone for watching. I think this is fun. I enjoy doing it. I really enjoy you guys asking questions like this instead of me just coming up with questions. So we will continue this. I think we'll do it next week too, because I actually have quite a few in here, but feel free to keep posting. And then if it's something you can't wait for, you can always message me. So we're in our group Wellness with Dr. Hillary. Just click on my name and you can shoot me a message too. Happy to answer anything and help in any way I can. So, hey, cheers to a good new year. All I have is my coffee cup. So cheers, new year, and look forward to seeing everyone soon.